involved in the behavior. Intensity, it can be measured, but you have to be really specific. So let's say that one of the behaviors was a self-injurious behavior. Okay, so Tommy bangs his head on the table. And let's say he doesn't do it that frequently, and it doesn't last long. But when he does, it causes severe injury. So then you would just define, actually there is a rating scale to measure intensity of self-injurious behavior, but you would just follow that. There's, I don't have it with me, but one is, was it bruised? Was there an open incision? Was there bleeding? All of that stuff to measure the intent, how intense was that behavior. And then the last dimension is latency. So latency and duration, make sure you don't get them confused because it has to never go with time. But latency, the definition is speed of behavior from some event to the start of the behavior. So for example, if I say, Joey, come sit at the table, that's the start of an event. I have asked him to do something. So then the amount of time it would take, did I say Joey? Joey to comply to the start of him walking to the table and complying, that's latency. Another example, Tommy, go clean your room. This is probably more common if I have parents in here, right? Go clean your room. The amount of time it will take your child to actually comply and go to his room and clean up the room, that's latency. Yes?
I was just thinking about how you relate this to behavioral problems or like relationship issues with like parent-child or spouse or your significant partner, where is that the same thing like when someone just has an authority conflict? Like let's say you just ask your spouse or your child like that, come, can you help me do this for me? And it takes an hour. You have to ask them 3 or 4 times before they want to get out. Where do you draw the line between maybe too lazy or they don't want to do it for whatever reason, tired, not interested, or authority issue? Just because you ask, maybe they're just resisting you didn't just ask.
Right.
And behavioral problems.
So if this is a consistent problem, and that's something else, if it's just happening a couple of times, I wouldn't worry about it. But if it's a consistent issue, you could definitely use the principles. As far as being self-injuries? Or what did you say?
Anything.
It can, and that is something too. When we do our interviews and all our research before, we need to make sure that it is a behavioral issue and that it's not something medical, because it could be something medical, right? Or cognitive. We need to make sure that if it's absolutely behavioral, then yes, the intervention will be effective. Yeah. But that all comes from the initial assessment process and interviews and all of that, which we'll go over, I think, later.
I think I'm hearing, okay, let's say you come across someone who has an authority issue. Let's say I'm a parent, and I say my teenager just has an authority issue. If his father I even ask, they'll just completely rebel just because they don't want to do anything anyone tells them to do. They feel like they're being bossed around. For whatever reason. How would you all use behavioral analysis? Could you do exactly?
Well, we would go in, and we'd have to do ours. We couldn't just say yes or no. And that's something too. Once if you become certified, there's probably gonna be a whole bunch of people asking you questions. My child is doing this. My kid's doing this. My mom does this or my whatever. You cannot give them advice because you don't have data. You can't give them anything. So you have to go in, conduct your assessment. First, make sure it's nothing medical or whatever. Conduct your assessments, all of that, and then, hey, yes, there's something, let's try implementing this.
Where do you draw a line? Let's say your parents did come to you asking that their child just gets B's and C's in school, but they really believe that he could get all A's. So you could have set up a system where he has to study more, even though there's nothing that he's not harming himself or anything, and he's pretty much an average child. When do you draw the line where you have to tell maybe the parents maybe this is not ethical, maybe it's not what he wants, there's some autonomy? How do you deal with issues like that?
That's a very good question. Yeah, anytime if a parent comes to you, especially once they hear BCBA or behavior analyst, you don't always have to accept, right? You don't always have to say yes, and especially if it's not in your area of competence, then you wouldn't accept it. And if you feel that, let's say you do an assessment, right? But you feel that, are these really socially significant behaviors that I'm changing, or is it just to please the parent? And if you feel that it's not gonna, it has nothing to deal with their, to be able to function out in their environment, then you just decline. You don't have to say no, you just decline. And then you could, and if you feel that maybe someone else, right, could benefit them, then you could refer them, of course. You never want to leave them out in the cold. Yeah. Let me answer them. Yes.
Would you say that you would need to get a referral from a psychologist or a medical doctor?
Nope. The parents can just come directly to you.
Well, based on that one, like you were saying that parents a lot of times have to help out. Now, let's say the parents don't help out. Do you still have to continue helping the child even though you don't see the group because the parents
Nope. You would have to decline services. And that is actually even before you start working with the family, you draw a contract and you outline what your responsibilities are, what their responsibilities are, and you also put in there that in any event, this is not being, you're not complying with them, termination of services will be, issued. Yeah. So that happens. Or it happens where mom will be consistent and dad will not be consistent. And then you just see that the child is not progressing and yep. Did you
Well, I was going to say, if you know, maybe an example that, because it's not a license, it's a certificate, as you stated, so ethically, what are you obliged to, by law?
We have our guidelines. We have our ethical guidelines, and if you go to the board website, bacb.com, we have our whole list of ethical guidelines that we have to abide by. So that's what we follow.
But is that just more of a professional approach? I mean, legally, are you obliged by this difference from a license of a PA?
Well, I think with any type of profession, you do have, a legal. There is a legal issue. What do you mean? If it comes to neglect?
Let's say an example I use. Let's say the child then comes and decides to sue you because we're making him do things that he didn't want to do, and say that you invaded his free will.
But that's where you have parental consent forms.
Okay, so then that would be overrun by that.
If the child's under a certain age.
So he legally couldn't do anything to you because of that?
No, as long as you get parental consent. And that's in all of that, you learn once you all want to be, if you become certified, we take an ethical course, and so you learn all of that. You don't just start services. There's documentation that needs to be done before. Yeah. You have a question?
Those initial assessments, you're doing them in the presence of the child, right? What happens if the behaviors aren't appearing when you're at the test?
Yeah, that's a good question. And it happens. It happens to where in the interview, mom or teacher will say, oh, they do this, 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 this. You go and you observe, and that day or 2 days, you don't see anything. So you actually then, in your interview, when you ask, you ask about the behavior and you ask questions about that, an important question to ask is, when is the behavior most likely to occur? So let's say it's at the school, and the teacher says, well, you know what? It occurs mostly during math and reading, which are in the morning. It doesn't really most likely to occur, and we're not even going to bother with the afternoon because he's fine, right? So if we go and let's say a couple of days, he doesn't, that actually might even have to deal with reactivity, which we'll talk about. So maybe they see you watching them, which that too, right? You don't want to be just staring at them. So that too might be a factor. So you would just have to kind of extend your observational days and you will see behavior. That's the question.
Does the child have to know that you're going to observe him?
Oh, we'd have to get parental consent.
But does the child have to know that you're watching him?
I mean, we can introduce ourselves, but as far as legally, I mean, a lot of it just has to do with the parental consent form. No, we would, no. When you're doing observation, you can, but you're going to get better data when you're in the natural environment. Yeah. Because what you're doing is trying to figure out why the behavior occurs. So let's say it's in math, right? I want to tell the teacher, go on with your day, pretend I'm not here, because I want to see when Tommy has the behavior, I need to see what she's doing. What are the consequences? Because that's going to help me to, identify the function of the behavior. Yeah. So natural environment is best. Okay. Other dimensions of behavior, which, so behaviors can be observed, described, and recorded by others or even by the person engaging in the behavior. So if they are cognitively competent, right, if they're able to understand, then they can actually record their own behavior too. And then you could draw a contract up with just them because let's say you're dealing with someone, who's trying to lose weight. If you're working with weight control, then you can just tell them, what type of data to take on a daily basis. Or if someone, who has a habit of biting their nails or whatever, then they can, take data themselves if they can. Okay. And then behaviors have an impact on the environment, including physical or social. So, in order for it to be a behavior, it has to have an effect on the environment. So when I do this, what happens? Does it have an effect on the environment?
Yes.
What happens?
Your eyes are shut.
What else happens?
It's dark.
It's dark, right? The lights turn off. When I flip the switch up, what happens? Light goes on. When you raise your hand, what's the consequence?
You call it.
I call you, right? Mm-hmm. When your phone rings, what do? You answer it. So, and when you answer it, what happens? Somebody else responds to you, right? So if your behavior has an effect on the environment, then that is an observable, measurable behavior. Okay? Yes.
I have two questions.
Yes, sir.
The first one is, what's the deal with confidentiality between the analyst and the participant?
Okay.
Are you? Let's say they want to stop doing something illegal. Mm-hmm. Are you obliged to contact the authorities if they're doing something illegal?
Yeah, it's the same principles, even with license, with any fields. Yeah, we have to abide by the law. So if it's something that's going to harm, we have to follow those.
It's going to harm themselves or
somebody else. Yeah.
Also, in clinical and counseling psychology, there's a big ethical issue as far as treating people you know.
Oh, we don't do that either.
Is it the same here?
It's the same. Yeah, we have. Yeah, definitely. Conflict of interest. Mm-hmm. We don't. If you have, your brother, that's been diagnosed with something, and you know that ABA is good for him, you yourself
Can you participate in the program, or you just have to watch?
Same goes for spouse and child.
Yep.
When you set up your own programs, like you set programs for people who want to stop their consent marriage or for smoking, that sort of thing.
Yeah, you can implement. If you're competent in that area, yes. Like if you specialize in it, yes.
Well, because it's very funny because I know some people are like, oh, I only drink socially or I rarely ever drink, 2 or 3.
But when they do,
Well, it's not just that. It's like, okay, but then you're out, Tuesday, Wednesday, Thursday,
Yeah.
Friday, Saturday, Sunday.
So they're pretty social.
That's 2 or 3
Yeah.
drinks, 6 days out of the week.
Right.
Yeah.
Right. Yeah.
Adds up to.
Yeah. But then they would be an adult, and so then they would have to want, right? They have to want to reduce that behavior. Yeah. And of course, if they're your friends, you would be able to do it. Yeah. And the last one is saying behavior is lawful, and that just goes back to saying that there must be a functional relationship between the environment and your behavior. Okay? All right. So behaviors can be both overt and covert. With behavior modification, we look more with overt behaviors because these are actually actions of other of individuals, right? These are actions that we can see, observable behavior. Versus covert behavior, which are known as private events. So these are behaviors that we cannot see. So, for example, thinking. That would be a covert behavior because if I were to look at you, can I see that you're thinking? No, right? I can't see that you're thinking. I can't see that you are sad. I cannot see that you are mad. These are, remember, all like feelings words. They're private events. They're internal because I can't see that. I wouldn't be able to measure it. Okay? So what kind of behaviors do behavior analysts look at? Over. Why? This is observable. Observable and measurable. No? Okay, I'll give you it. Any questions? I'm going to go through some examples, and I want you to be able to tell me, based on the behavior, what dimensions could you measure? Okay, so the first one, Martha sits at her computer and types a letter to her parents. So, first of all, how many dimensions of behavior are there? Dimensions of behavior? 4. The 7 are dimensions of applied behavior analysis, which is the field. Okay? Which was the article. But there are 4 dimensions. And what are they?
Frequency, duration, intensity.
Frequency, duration, intensity, and latency. Yeah. So when you look at this one, Martha sits at her computer and types a letter to her parents. What are some dimensions of behavior that we can measure?
Frequency.
Which one? Frequency. Yeah. How many words did she type? What else?
Duration, how long she typed.
Duration. How long did she sit at the computer and type? What else? Latency. So when she sat down at the computer to when she actually started typing, that could be. What else?
Intensity. intensity, but how hard she pressed the
Intensity, right? How hard did she press the keyboard, the keys on the keyboard? Yeah, was it light, soft, or, some people, right? Was it more intense? Okay? Yes?
Intensity is only measured by, like, physical force.
Right. Yeah. So how, like that behavior, how much physical force did it have on the environment?
It could be measured as emotional, right?
Exactly. Yeah. Yeah. Okay. The next one. Mandy lies in her crib and cries loudly. Her mother then picks her up and feeds her. Latency. So, from when Mandy starts crying, in this case it would be mom feeding her. From when Mandy starts crying to when her mom actually goes to the room and feeds her. What else?
Duration, how long she cries.
Duration, how long did Mandy cry? Any other?
Maybe like how many cries she makes, like.
Yeah, how many times did she yell out? Yeah. That could be one. Could intensity be one?
So how loudly she cries.
How loud, right? Yeah, you could measure that. Was it just like a, kind of medium tone? Was it a loud tone? Yeah, you can measure that. Okay. Is it interesting how now you look at the sentence and thinking, wow, there's so many different ways that we can actually measure the behavior, right? Yeah. Okay. This last part is just kind of talking about behavior modification as a field. And so it's behavior modification, right? That's kind of like the general term. And then there are two different areas. One is the analyzing part of it, which is where you are going to identify the why. Why is your behavior occurring? The functional relationships that your behavior has on the environment, or that the behavior has that the environment has on the behavior. And then the modifying part of it. So what are you going to do to change the behavior? Whether it's a behavior that you want to increase. So for example, social skills would be a behavior I'd want to increase. If the child doesn't even know how to go up to a peer and play, then I want to increase it. Or is it a behavior that I want to decrease? So let's say it's self-injurious behavior, and he's having to go to the doctor all the time to get stitches on his forehead because his head bangs too much. That would definitely be a behavior I would want to decrease. Okay, so modifying and analyzing behavior. And this, it's one thing talking about these behaviors and learning about it, but when you actually see it and then you implement the program and then you see the effectiveness, it's amazing. Because when I was doing my practicum hours, I remember one of the first clients I saw was an adolescent, and the first thing he did when he came out of the school bus was immediately, he had self-injurious behavior. He would headbang, and literally, it was open. He had an open wound on his head that just kept being reopened and reopened and reopened. So, once you know how to decrease behaviors and you implemented it, not only for the client, but you feel you help this person, right? Yes.
What is the line psychologically where you all as analysts have to realize why they're doing what they're doing and address the underlying situation of not just modifying the behaviors, but
That's why first identifying that it is behavioral. That's all we deal with. We don't go any more than that.
Like in that case, obviously would be,
It is, and it was behavioral because he did not want to get off the bus.
So he was setting himself that weekly.
Yeah,
And then
that was his escape. It was actually escape because he didn't want to come to school and he didn't want to sit at the table and he didn't want to work.
Do behavior analysts refer psychologists?
Yes. Yeah. Definitely. If we feel that maybe we've only done so much that we could do for the behavioral part of it, but yeah, if it's something cognitively, then yes. Okay. Oh yeah. Focus on behavior. Okay. So the behaviors that you are trying or that you are going to change, whether it's to increase or decrease, is going to be known as your target behavior. So that's something that you'll hear a lot of. If someone says, oh, well, what are his target behaviors? Lobbing to the floor, kicking his peers, and screaming at his teacher. Those are all three behaviors that we are going to change. Those are his target behaviors. They're going to be modified. Now, there's two different types of target behaviors. One is behavioral excess. So these are behaviors that are occurring at a high frequency that you want to decrease. So, for example, one was smoking, drinking. I mean, any behavior, right? Let's say you have someone that smokes a lot every day, but they want to decrease. That would be an example of behavioral excess. Okay? And then a behavioral deficit is a behavior that is occurring at a low frequency that you want to increase. So, for example, these are just some, exercising and studying. Let's say I, need to increase my behavior of exercising. That would be a behavioral deficit because it's not, let's say I only go once a month and I want to go, 5 times a week. And that would be something that I need to increase. Or studying behaviors. Because we can also define studying, right? That's kind of general. We can be more specific. So that would be something that also that we could increase. And then just some other points to kind of cover. All our procedures are based on behavioral principles, which I've already explained. And there are two areas of behavior analysis. There's the experimental part of it, okay, which basically is it's the study of behavior. So these are the individuals that conduct a lot of research in the lab, using these principles and applications. With we have our rat lab in the behavioral neuroscience building. Has anyone been there? Well, it's pretty cool. So that's where we do our. I know for I don't know if they take undergrads there, but I know for graduate work, for some of our courses, that's where we have to go to implement these procedures based on the behavioral principles. So that's more of the experimental route, and then you have the applied route. And the applied is where we take that study, right, of human behavior, and we apply it to individuals. So based on the studies, that have shown that this is, this increases, this decreases behavior, then we would apply it to humans. And then, what else? Emphasis on current environmental events. That's important because although I do care what happened in the past, I can't change what happened in the past. I can change what's happening right Tommy's mom took his homework away. That already happened. So for right now, I'm only looking at what's happening right now, today. So that's just basically meaning you can't ask the mom questions about past events and then put a plan together based on those past events. No. You do current observations on behavior. Yes?
I had a question about the two parts of behavioral analysis, the experimental and the applied part.
Mm-hmm.
So, as a behavioral analyst, you apply both, because you provide data and things, so you are kind of experimenting.
It is, yes, but with the you do a little bit of both, but it is more with human beings versus the experimental is more where they're just kind of in a lab with either animals or we implement them as in the applied part of it. We actually implement them with you. And then treatment implemented by people in everyday life. That's important because we also want, remember, we want generalization to occur. So it is important that mom implements it and grandma implements it and teachers, everyone in the environment. And then measurement of behavior change is important because that's where we're going to know whether our intervention is effective or not. And then de-emphasis on past events as causes of behavior. I just kind of mentioned that. And then rejection of hypothetical underlying causes of behavior. Now, Skinner had his thoughts about, Sigmund Freud's theory, psychoanalytic theory. And to Skinner, he stated that Freud's theory was, explanatory fiction. So not based on his theory, right, based on his psychoanalytic theory, it cannot be proven or disproven. Because based on his theory, it's not concrete, it's not something observable or measurable. You can't see it, right? What was it? The ego, I can't, right? I can't see that.
You can't test out that.
You can't test it, it's not measurable. And that's all he was saying. So, okay. And then, lastly, just a quick overview of major figures in in the research of behavior modification. Ivan Pavlov kind of got things going with his respondent conditioning. Who remembers Ivan Pavlov? What was his famous study?
The bell and the dog and the dog.
The bell and the dog. Yeah, and he said that he was able to demonstrate that he could condition a reflex, a natural reflex, to a neutral stimulus. So with him, it was the natural reflex of what? Remember?
Salivation.
The salivation, right? The dog salivating. That was a reflex. Because did somebody have to teach the dog to salivate? No. It's just something that's natural reflex. So he said that he could condition the occurrence of salivation through a conditioning with a neutral stimulus, which was the bell. Right? So neutral stimulus is just something that basically has nothing to do, doesn't elicit the reflex at all, but it's something that you could teach that person. So that's what he did. After several pairings, he noticed that when every time the lab assistant would come in to feed the dog would salivate, right? So what he did was, as soon as they fed the dog, right, dog salivated, at the same time they would ring the bell. So So they're pairing the bell with salivation. So next time, after several pairings, it doesn't happen over, just once. But after several pairings, then what happened was just the ringing of the bell elicited salivation without the food. And so that's what basically, respondent conditioning. Okay, that was Ivan Pavlov. Then we had E.L. Thorndike, who talked about the law of effect. Who remembers what's his pigeons?
No.
What was it? Does anybody remember? It was in your book.
Cat?
A cat. Yeah, it was the cat experiment. So with E.O. Thorndike, the law of effect states that a behavior that produces a favorable effect on the environment is more likely to be repeated in the future. So with his experiment, yes, it was with a cat. He had a cage. He had the cat was in the cage. He had a little lever to the door, to the cage, right? Mm-hmm. Then he had a bowl of food, but he put it on the outside. Okay? So once the cat was taught that, when I press the lever, the door opens and then I get access to my food, which food serves as a reinforcer. That was the consequence to his behavior, right? Press the lever, the door opens, I get food. Law of effect. So next time the cat's in the cage, food is right there, what do you think that the cat's going to do? Press the lever. Okay? That was the start of kind of, the behavior. It was Pavlov and E.L. Thorndike, and then we had Watson, who started that movement in behaviorism. Okay? And then B.F. Skinner he expanded on the field. So he was the one who kind of distinguished the difference and expanded on, respondent conditioning versus operant conditioning. And operant conditioning expanded on basically the law of effect. So it's not necessarily what happens before the behavior, but also what's the consequence to the behavior. And that's what's going to make that behavior occur again in the future. So, for example, with the cat, pressing the lever, that's the behavior. Presses the lever, cat gets out, he gets to eat the food. That's the consequence. Based on that consequence, then the next time, that increased that behavior of the cat, pressing the lever to get the food. Okay. All right. And then last, I'm not going over all of these different areas. They talk a little bit about them in your book, but this is just to show that it's not just in the field of autism or developmental disabilities. It's in all of these different areas that we can apply, behavior modification. So self-management, child management, rehabilitation, clinical psychology, education, special education, all of these fields. Okay? Any questions, comments?
What if, you say, that sometimes if the parents don't, also cooperate with, movement, what if the person they're trying to treat just doesn't want to cooperate? Then what do you do in that situation?
Oh, yeah. Well, that's actually going to be something that we would work on. Oh, yeah, that happens. Oh, yeah. So that's why we use, but that's what the program is for. We put a behavior plan together, and there are applications you can use to get, and procedures, to get them to come. Oh, yeah, because, let's say first day, they come sit at the table, and they've never sat at the table before or had to work at a table, they're not going to want to do it. You'll get bolting, you'll get screaming. I've gotten, you get bit, you'll get scratched, you'll get You name it and you'll get it. But after time and after implementing the application, it'll.
What if the parents are the cause of the behavior? Like, let's say.
That's why you train them.
You train the parents as well at the same time, but you're telling them, oh, don't do that or that's it. But I mean, like, what happens if it's like the boy who's sitting his head on the bus? Now, what happens if he's sitting his head on the bus because he doesn't want to go home? Now, is that an issue of?
Then that wouldn't be something. Well, unless something's happening at home,
So that's why I was
that
wondering,
wouldn't.
do you have to just call in authorities?
That
at
probably
time,
wouldn't be, behavioral. Yeah,
Okay.
we have to make a referral.
Okay.
If we feel that, as soon as we went out of home,
Yeah.
that's a different, Okay, if that's it,
Sure. No. That was great. No, like.
That's what I did.
Yeah, I actually didn't go.